Pityriasis alba. Definition. Pityriasis alba is an idiopathic hypopigmentary condition that appears clinically as white, alba, patches with overlying fine, bran-like, pityron, Greek for bran, scales. Pityriasis alba hypopigmented patches in a child. Incidence. The disease is extremely common but usually not sufficiently disturbing for most patients to seek medical attention. It affects mainly children between the ages of 3 and 16 years and is most common, or most noticeable, in darker-skinned individuals. It is a chronic condition, with periods of flares and resolution. Individuals with atopic dermatitis have a predilection for pityriasis alba. Note: Pityriasis alba is most commonly recognized and appreciated in darkly pigmented children but affects children of all skin tones. History. Pityriasis alba is usually asymptomatic, although an occasional patient may complain of mild itching. Patients or parents are most concerned about the appearance of the lesions. It may worsen in the summer months with increased ultraviolet, UV, exposure. Physical examination. The early lesion is a mildly erythematous, slightly scaling patch with an irregular but defined margin. Most often, only the subsequent lesion is seen, a 1 to 4 cm white patch with a fine, powdery scale. In children, the face is the most common area of involvement, and they may have 1 to several lesions. Pityriasis alba can occur in other locations. Another common area of involvement is the upper arms, especially in children with atopic dermatitis. Rarely, widespread involvement occurs. Pityriasis alba, hypopigmented patches on upper arms in an adult. Differential diagnosis. The disease is most often misdiagnosed as Tinea versicolor. In temperate climates, adults with Tinea versicolor seldom have facial involvement, but in children, in whom the disease is much less common, the face is affected in approximately 1/3 of cases. Accordingly, a KOH preparation should be performed on all scaling white spots to rule out Tinea versicolor. The white spots in vitiligo are distinguished by sharp demarcation, complete depigmentation, and a lack of scale. Post-inflammatory hypopigmentation from inflammatory dermatoses, example, atopic dermatitis or psoriasis, is distinguished by the history and extrafacial distribution of skin lesions. Differential diagnosis of pityriasis alba. Tinea versicolor. Vitiligo. Post-inflammatory hypopigmentation. Post-inflammatory hypopigmentation. Hypopigmented patches on the chest in a child with atopic dermatitis. Note multiple warts on hands and around the mouth. Laboratory and biopsy. No specific laboratory test is available to establish the diagnosis, and it is typically recognized clinically. The KOH preparation is negative. The histologic picture is nonspecific, showing slight hyperkeratosis, decreased pigmentation in the basal cell layer, and a mild inflammatory reaction in the upper dermis. Pityriasis alba. Epidermis, hyperkeratosis, decreased pigmentation. Dermis, mild inflammation around superficial blood vessels. Therapy. Treatment is not often necessary as spontaneous resolution occurs. Moisturizers can be used for the dry scaling, and 1% hydrocortisone cream is used for the inflammatory reaction. Studies have shown that twice-daily application of tacrolimus 0.1% ointment or twice-daily pimecrolimus 1% cream can also be effective. For more severe diseases, a trial of triamcinolone 0.1% cream twice daily for several weeks may be beneficial for involvement on the trunk. Therapy for pityriasis alba. Initial. Moisturizers. 1% hydrocortisone cream. Alternative. Tacrolimus 0.1% ointment twice daily. Pimecrolimus 1% cream twice daily. Triamcinolone 0.1% twice daily, avoid chronic, continuous application. Course and complications. The patient must understand that repigmentation will be slow. In most patients, the disease resolves spontaneously but can take months to years. For affected children, the disease rarely persists into adulthood. The disorder has no complications. Pathogenesis. The origin of this common disorder is unknown. Most investigators believe that the decreased pigment is a post-inflammatory phenomenon and that the initial event is a low-grade eczematous reaction. It may be a manifestation of inflammation related to decreased barrier protection from dry skin. The fact that the condition is commonly seen in children with atopic dermatitis lends credence to this dry skin association. Note, Pityriasis alba may be a low-grade eczema.
Clinical case. An 8-year-old boy is brought to the dermatology clinic because of several light-colored patches on his cheeks that have gradually appeared over the past few months. His mother is concerned that the lesions are spreading. The child is otherwise healthy and reports no itching or pain. On examination, there are multiple ill-defined, round to oval hypopigmented patches with fine scaling on both cheeks. The lesions are not completely depigmented. Wood's lamp examination shows no accentuation, and potassium hydroxide (KOH) examination is negative for fungal elements. What is the most likely diagnosis? A. Pityriasis alba. B. Tinea versicolor. C. Vitiligo. D. Post-inflammatory hypopigmentation. E. Nevus depigmentosis. Correct answer, A. Pityriasis alba. Explanation. Pityriasis alba typically occurs in children and adolescents, especially on the face. It presents as ill-defined hypopigmented patches with fine scale, often associated with dry skin or atopy. Tinea versicolor usually affects the trunk, neck, and upper arms. KOH examination demonstrates malassezia, spaghetti and meatballs appearance. Vitiligo presents as well-demarcated depigmented macules and patches with accentuation under Wood's lamp. Post-inflammatory hypopigmentation follows a preceding inflammatory dermatosis, e.g., eczema, psoriasis, trauma, which is absent in this case. Nevus depigmentosis is a congenital, stable hypopigmented patch present from early childhood. Teaching point. The classic examination clue for pityriasis alba is a child with ill-defined hypopigmented facial patches and fine scaling, without complete depigmentation or positive fungal studies.